Okay. So again, we're going to be talking about what causes these different axis deviations. We've learned how to determine what is what, so now we'll see what's caused it in the first place. First thing we got up here is left axis deviation. The first little point I've got up there is the normal variation. Again, that's that physiological left axis deviation, the 0 to negative 30 degrees. It's normal. Technically, it's a left, but it's not anything abnormal. You're fine. If yours is somewhere in that range, you're fine. You've not had a heart attack or anything crazy. Okay, something that can cause it, the first thing I got there is LVH, or left ventricular hypertrophy. What that is the left ventricle of your heart has gotten big, it's enlarged. And usually that's caused by high blood pressure. Your heart is a muscle, and like any muscle in your body, like say you go to the gym, you start lifting weights, eventually your biceps are going to start getting bigger. Your heart's the same way, it's a muscle just like any other. When it has to work extra hard because you have high blood pressure and it's pumping really hard, it eventually gets bigger. That is a bad thing. It doesn't mean your heart's just that much stronger. And just because it's so much bigger, it can kind of almost throw off the electrical pathways a little bit. In that case, that's definitely not life-threatening. It's just going to show up a little weird when you get an EKG. It's not going to be normal. It could be kind of left axis or something. Next thing is conduction defects. We looked at those nerves running through the heart, the little green nerves that had running through that heart. Conduction defects are, basically what it says, something has happened somewhere to one or more of those little nerves to cause electricity to either not flow through that area, or to have to reroute around it, or to be slowed down when it hits it before it can continue on. And usually that's something like what I've got next on here is an inferior wall MI. That means the MI is myocardial infarction, it's a heart attack. And the inferior wall is kind of the bottom and right-ish side of your heart. So, like all tissue in your body, those nerves running through your heart also need blood. Everything in your body needs blood flow, oxygen, nutrients, and everything. When you have a heart attack, the blood flow is cut off. So the blood flow gets cut off to those nerves, they no longer function. Or at least not properly for a while, and if left untreated, they will stop functioning entirely. So that could be causing it. When that's not functioning properly, the electricity might have to reroute around some different way, and it'll show up crazy on your EKG, it'll look weird. Something called pre-excitation syndromes. I've got in parentheses here something called Wolff-Parkinson-White syndrome. What that is, and real quick, I'm going to come back up here toward the beginning. Don't worry, we're not going over it all again. Okay. What will happen in a pre-excitation syndrome or something like Wolff-Parkinson-White is you'll have what they call like an extra electrical pathway. So basically, I'm just going to use it as an example. This little nerve here, let's say it grew a little too long and came all the way up here and met back up with this one up on the top, or at least grew somewhere really close to it. What can happen is that electricity travels down, goes all the way back up, and then just starts like this endless little cycle. Your heart starts beating 250 times a minute, really super fast, because the electricity is just circulating around that little area, and it's making the whole heart beat really fast instead of like it normally should. Doing that, like I said, the electricity will kind of be circulating around, and it could show left axis deviations as it's kind of going down from around there. That's not quite the only syndrome, but that's kind of the more popular one of those pre-excitation syndromes, so that's the one I kind of mentioned. Also something called VTAC. When we looked at that extreme right axis deviation, that ugly, nasty EKG, that was VTAC. That is a lethal rhythm. Those AEDs they put on your chest when you're in cardiac arrest, that's one of the rhythms that's going to shock because it's a lethal rhythm and it has to reset it, or you're going to die if you're not already dead.
So VTAC can be either left axis or extreme right?
It can be extreme right, left, or right, depending on where it comes from.
Gotcha.
Because you got two ventricles and take up a large portion of your heart, so depending on where the impulse actually originates from could show anything except normal, basically. So then congenital heart diseases, heart defects, little babies born with holes in their heart or just some kind of deformations to the heart. or it could be deformations to the actual electrical pathways instead of the actual anatomy of the heart muscle. It could flow some crazy way because of that. Now, hyperkalemia means you have high potassium in your blood. Your heart needs several different electrolytes to function, and potassium is one of the most common ones that is often thrown off a little bit and can cause your heart to beat kind of weird. Emphysema, that's issues with your lungs. Your heart and lungs are tied in very closely with each other. If you have an issue with one, you're usually going to have an issue with the other. The same thing here. Mechanical shifting of the heart, that more so is like with pregnant women. When the baby grows inside of them so big, it kind of pushes everything up and causes the heart to actually shift a little bit. It will show up on an EKG as some sort of axis deviation, just because the leads can't tell that your heart has moved. All it does is tell how the electricity is flowing between them. So even though it may be flowing normally in your heart, it may be shifted a bit, so it shows that it's flowing left or right or something like that. And then pacemakers. People get a pacemaker put in because of whatever heart problem they've had. Those things, they look like that VTAC EKG we looked at earlier. It is an ugly looking EKG. It does all kind of crazy stuff. Right axis deviations. So there's normal variation in children and young adults. When all babies are born and up until kind of like the later toddler years, around 6 or 7 or so, pretty much all children have right axis deviation. I'm not going to go into it too much, but they also have what they call a right ventricular strain pattern. They have larger right ventricles than they do left, because in the womb they used to lump the right ventricle more than the left because the umbilical cord circulates the blood. Anyway, right ventricular overload syndromes like congestive heart failure, right ventricular hypertrophy. We talked about left ventricular hypertrophy earlier. This is just the right ventricle instead of the left. Your right bundle branch blocks, which is the same thing as those the blocks in the electrical pathway due to some kind of heart attack or whatever. It just damages the electrical pathways, so it gets rerouted or slowed down or something. It looks a little weird. It has to come from a different angle to kind of contract the whole heart. Congenital heart diseases, defects, there's more than I could ever name. Dextrocardia, left pneumothorax. A pneumothorax is basically a collapsed lung, if you've ever heard that on TV or whatever. It's a collapsed lung. It fills your whole chest up with air and can kind of like push your heart to one side or the other. Mechanical shift again, and right ventricular strain, like I mentioned with babies. Kind of have that, and CHF, the big one that causes that. So extreme right axis deviation, a lot of it is the same as right axis. A lot of that stuff can kind of be interchanged. And the last little point I got there is it's usually VTAC. Not always. That Wolff-Parkinson-White syndrome is another one that can cause an extreme right axis deviation just because of where the little extra pathway is and how it ends up recirculating around the heart. Could show extreme right, but usually it's that VTAC, that really bad fatal rhythm. So I think that's about all I got for you guys. Hopefully you can understand a little bit more about axis deviation and what causes it and how to determine it. That's it. No more
I didn't know y'all had to know so much. It's a lot. So what's the difference in VTAC and VFib? Or is that just not even totally?
It is, you can stop it.